Hi, everyone, and welcome to That CBD Show. As always, I am Christy Burkhead, and with me is Drew Burkhead. So today, we have something really special. We have a very special guest with us, all the way from Virginia. And I am going to, her resume is so extensive that I actually couldn't memorize it. So I'm going to take a minute and tell everyone a little bit about the background of this guest, and then we will bring her on. So she is a native of Shepherdsville, Kentucky, graduated from Auburn College of Veterinary Medicine in 1993. After spending a year in private practice and 2 years in a 24-hour referral hospital as an emergency clinician, she began a 3-year neurology residency at the University of Missouri-Columbia. After completion in 1999, she stayed on as a clinical instructor, overseeing the neurology, neurosurgical practice, as well as providing instruction to students, interns, and residents in neurology and neurosurgery. In 2001, she accepted a position at a busy multi-specialty veterinary referral hospital in Houston. In 2003, she had the opportunity to join a neurology-only veterinary practice in Las Vegas, where she was actively involved in the training of neurology residents, all of whom have gone on to become diplomats in the College of Veterinary Internal Medicine Neurology. She later spent 2 years at a multi-specialty referral center in Cincinnati, Ohio, acting as chief neurologist and medical director. She's called Leesburg, Virginia, and Bush Veterinary Neurology home for the past 9 years, acting as medical director for 5 years and continuing as senior neurologist neurosurgeon. She's been actively involved with the training of many neurology residents and interns. She has presented lectures both at the local and national level, as well as co-authored several book chapters and scientific articles pertaining to veterinary neurology. She was the recipient of the 2003 College of Veterinary Medicine Auburn University Young Achievers Award, and also received the 2006 Distinguished Alumni Award from Eastern Kentucky University, Department of Agriculture's College of Business and Technology, and in 2013, she obtained her ACVIM Neurosurgery Certificate of Training. She is past secretary of the Veterinary Neurosurgical Society, and her passion lies in all aspects of neurosurgery with an interest in brain and cervical neurosurgery. So that is a mouthful, and I am so excited to welcome this guest. She's joining us from Bush Veterinary Hospital Clinic Neurosurgery in Leesburg, Virginia. Please welcome Dr. Joli Jarboe.
Welcome.
Thank you for joining us today. It's really nice to have you. So that is a mouthful. Your resume is very impressive. And so we wanted to bring you on because you have recently, or in the last, year or so, become involved with the UltraCell, the same product that Drew and I represent, and we love it. And so we asked you to be on the show today. And what we wanted to start with, Joli, was for you to tell us your experience finding the UltraCell, say from the segment of time that CBD first just came across your radar, and then to when you found the UltraCell and began putting it into practice. Can you tell us a little bit about that journey?
I certainly can. It's been a long journey. When I was in Vegas, there was 2 nutraceutical companies aimed at pet products, dog and cat, and later went on to other species. They had a granulated cannabinoid product that they were using and promoting, and so it really crossed my threshold or my level of awareness from clients, listening to your clients and clients being interested in it. So I kind of settled on one of those companies. The CEO and I became kind of email pals, and I decided, I always like to look at other products that have one that I think is above all others. And these 2 companies out in Colorado were the the first innovators in pet CBD hemp type products. People were coming to me because of all the hype surrounding epilepsy in children and the Charlotte's Web, getting the child Charlotte getting a lot of notoriety because her seizures were very responsive to cannabidiol therapy. And so a lot of owners were interested in that as an alternative therapy for their dog's seizures. And also a lot of humans were seeing relief with joint discomfort. And so a lot of owners were wanting to extrapolate that in their pets. So I went with this one product and really stayed loyal to them for about 10 years or so, 10 to 15 years.
Oh, wow.
Probably more like 10 because anyway, that's neither here nor there. But that was the one that I would go to because to the best that I could trust their processing, their standardization, quality control. That's who I knew, who I was familiar with. And so we'd go with that product. Now, was I convinced it was helping? Not every one of them. Yeah, I didn't. But it was something owners wanted, and so I would try to direct them there to see. It's a lot like when you get into the business of the industrial hemp products, it's a lot like the business of non-steroidal anti-inflammatories. Somebody may find benefit with acetaminophen while someone else needs ibuprofen. So it's very independent within the body what response you're going to see. UltraCell crossed my path really serendipitously close to almost a year and a half ago. I was really got into oil research about 5 years ago because that's when a lot more clients were bringing me different products. I can't tell you the hours I spent on the internet contacting CEOs of companies, getting samples of their products, trying to find certificate of analysis, trying to understand their processing and extraction measures. I think I aged about 20 years in 5 years in going through all this.
Wow.
And my sister actually knew an ambassador for UltraCell, the Davises, and she started talking to me about it. You've heard me speak. You've heard me tell this story. It was Thanksgiving. I was home in Shepherdsville, Kentucky. We had all had our bellies full and sitting on the couch talking to each other. And she started to tell me about this new product that Sandra Davis was trying to get her on board with. And I literally jumped across the couch at her, and I don't move very fast unless there's something very interesting in mind for me. And so that scared her, and I said, "You have got to get me a meeting with these people." I said, "I need to talk with them." And so a week went by. I think it was 1 to 2 weeks before I was next in Kentucky, and met with Sandra and Joe. My sister actually that night. I think the next day there was an ambassador meeting in Louisville. My sister joined because she knew I was going to join. So she became an ambassador, and I signed under her.
Great.
After meeting with the Davises. About 2 weeks later, I believe that was the time frame, 2 to 4 weeks later, I was back in Kentucky, met with them, signed on the spot because I'd had enough time to research. The thing I loved about the company was the transparency. We can see our certificate of analysis. We know that it's USDA organic. I know it's xylitol-free, which is important in the pets. I couldn't find any issues with the ingredients from a pet safety standpoint. I love the bioavailability study that they did. Again, in the 5 years of looking at human products and canine animal products, I've not seen anything like that absorption in any other product. And while that absorption may not be the same in animals, there has to be a correlation. If it's better in humans compared to other human products, it's got to be better in animals compared to other animal products. I'm in talks right now with a university to hopefully get that looked at, but it is a process, and people keep hammering at me about that. And it takes time, it takes money, and it takes people on both ends willing to do it. And so we're in the process of that. But I think it's going to pan out to show that it does have similar bioavailability that we see in humans. I see it clinically. I do believe it can be a very rapid absorption just because of what I see in the office setting.
Interesting.
So that's why I went with the product. Long-winded story. I'm sorry about that, but just
no, it's great. That's what we wanted to know is how you saw it, and especially someone in your position that's had so much experience in the medical field and particularly in the field of veterinary medicine. What was it that really attracted you and turned you on to this? So just explain to us a little bit in general what you see are the applications for CBD in the pet and animal world.
I think it has a strong correlation with humans, with us. I think that there isn't an application where it shouldn't be considered. I personally have begun to feel it's a little unethical if it's not talked about. Because it is such an easy thing to administer, such an easy natural supplement that has just infinite potential for benefit and little risk of adverse side effects. So in my mind, why wouldn't we be open to this? Things as easy as, we know that cannabinoids are potent mood stabilizers. We know that they help lower anxiety levels or our responses to sensory stimuli. It helps dampen that by raising anandamide. And so we know those things are very potent components of the cannabinoids that we find in this industrial hemp oil. And with our animals, there are so many situations where there is a high level of unease between their ears. Coming to the veterinary clinic, first of all, usually, a lot of dogs and cats don't mind being in the car, but many are very scared of that. So just even trying a dose
the trauma of getting to the
vet.
Yeah.
Right. And so just trying a dose prior to getting in the car. Thunderstorm anxiety, firestorm anxiety. If you've got teenagers that like heavy metal, that may be stressful to the cat in the house or to the dog in the house. So there are so many situations just on a day-to-day level that can help these animals be a little happier between their ears. One of the biggest problems that we have really is ownership induced. We take these dogs, let's say a husky that lives in an apartment with a woman, maybe looks like me, that's not very athletic, doesn't get out very, and do a lot of activity. That dog was bred to run. And so sitting in a small apartment, not getting out and running 10 miles a day might be something that sets that dog up for some undesirable behavior just due to pent up energy and anxiety. And so I think from the standpoint of helping, again, just going back to what I always say, helping them be happier between their ears helps the home life situation with the humans and animals coexisting. I think it has the potential to keep animals out of shelters. Because if we can help curb, undesirable behavior due to what we've imposed upon them, even in our efforts to love them, we can create neuroses that can be undesirable. I think there's a lot of issues, toenail trims, baths, going to the groomer, separation anxiety. We talked about fireworks and thunderstorms, gunshots, from Kentucky,
Yes, absolutely. Yeah, I had a dog years ago that was just mortified of fireworks, and we didn't have the CBD then. We didn't know. I wish I had something like that to try.
So, Dr. Jarboe, the reason it took so long to read all your accolades, there's so much. It's a pedigree. It's not even a resume. There's so much to it. But that's to create a foundation. So we can't cover everything in this time. Can people feel safe? Now they can see you, they can hear your words, they know your background. You're a neurosurgery. You're training doctors. Can people feel safe administering this? And what? And specifically, we talk about CBD products on the show before, that there's a lot of trickery that goes into people marketing things for pets. And really what we talk about is that you just need a very clean, good product that doesn't have any additives or preservatives,
Xylitol.
And it's done the right way. And then you take the UltraCell and it has that bioavailability. So I guess I'll circle back. And can people feel safe, and specifically with the UltraCell, safe administering this to their pets? And we're talking about things that you can see that happens with the animals, but there's also things happening in the body that you can't see, that it's doing internally and bringing balance. So can people feel safe and blend that in with the UltraCell, if you will?
I think that they can. I think the safety spectrum with UltraCell in particular is off the charts. I think I always say, with anything we inhale, ingest, or touch, there's a potential for an adverse reaction. People need to understand that there's not a guarantee when you've got a heartbeat. You can have an adverse reaction. And the two most common adverse reactions that we see actually in humans and animals, if the suggested dose is too much for that body, you can either see hyperagitation or hypersedation, usually within about 15 to 30 minutes after the dose. In our animals, if you've got a large bird like a macaw or a cockatoo and someone's using UltraCell with that animal, if it's too much, you're going to have a screaming bird on your hands for about 45 minutes, and you're going to really be aggravated yourself that you gave it.
Right.
The suggestion after that is to skip a dose and cut the next dose in half to see, because every one of our body our system is individually dependent. A suggested dose is just that, a suggested dose.
Right.
The Journal of American Medical Association in 2017 put out an article looking at 84 CBD products. 26 were labeled correctly. 36 had too much CBD. 22 had too little, and 18 had too much THC.
Amazing. Yeah, we've seen those studies. It's just unbelievable. There was one we saw where off the shelf it actually had E. coli in it.
Yeah. I mean, I trust we have, the Q code, barcode on our bottles that you can look at the certificate of analysis.
Right.
I know our sampling, our stock is clean, and that gives me great peace of mind. So as safe as anything can be, yes, I think it is safe. And then, so if your animal or you were to develop hives, if you have an allergic reaction to it, you can't take it. You're allergic to some botanical aspect of the plant, just like if you got allergy to oak leaves.
Right.
It's just not, you're not going to be able to take it, sadly.
Interesting.
Okay. Oh, I hear them yelling for you in the background there. So, Dr. Jarboe, let's talk about. You gave us some video and pictures of some pets that you've treated, and I know that our audience really enjoys seeing very specific scenarios and very specific stories. And I believe you mentioned to us that Samson was your very first. Was this your very first UltraCell patient, or your very first? Okay, so let's talk a little bit. Could you tell us Samson's story?
Yeah, I always have to give accolades to Samson. I didn't get a chance to meet Samson while he was alive, and this does have kind of the old yeller component to it, a sad aspect with their pets. But I was working at a referral practice in Lexington, doing some consulting there, and one of the emergency doctors knew that I would put on some of my discharge instructions if interested in cannabinoid products trial. One of these ones, the ones that I was using from Colorado. And so she called me up because she was doing relief work, and Samson was actually her patient. He had osteosarcoma of the thoracic limb, the front leg, and it's a horrifically painful bone cancer. And the owners wanted one more week with him, and he had a transdermal fentanyl patch on board. He was on tramadol, potent opioid. He was on gabapentin, a drug used to reduce nerve-based discomfort. And I believe he was on Tylenol with codeine, and nothing was stopping his pain. I think they had family members coming in town and just wanted one more week. And so she called and asked if she thought this other product would be effective. And I told her, I said, in 10 years of using that product, it's not going to touch this kind of pain. Plus, you've got to order it. I had literally just picked up my UltraCell from the Davises. And I said, but I've got this new product that I'll give you a bottle to give to this owner to try just to see, because we've got nothing else. We're failing. Medicine's failing this patient in providing relief. She called me the next day. He had 2 doses, and they had to put a leash on him because they were afraid he was going to fracture his leg because he was so happy and jumping around.
Oh.
So while in the end, there he is. While in the end, a sad outcome. It's a good outcome and a win, because we were able to give him the happiest time he had left. And I always tell people, if Samson was my only success story with any of these products, I still would sing its attributes, because I know that if it helped Samson in the face of all those other drugs, that maybe the 2,000 other patients like Samson would find benefits, and that would be one more per dog I could help. So that, right off the bat, sold me, if I had any doubts whatsoever, that it had great potential and was something to take a serious look at. Clients these things to me, and I think as doctors, we can't get up on our high horse too much with when clients bring us a suggestion. So me getting into the cannabinoid business and the hemp oil business has really been client driven. I've paid attention to clients and successes, and we don't know everything, and it behooves us to, sometimes close our mouths and listen to what is in front of us. Let the animal tell us if they're doing better or not. You hear me say all the time, animals rarely give us a placebo effect. They're either urinating outside the litter box, or they're not. They're licking the carpet at night, or they're not, or they're limping, or they're not. So my patients give us a pure response if you are quiet enough and observant enough to listen.
Oh.
I admire that so much, that you embrace that, and that you embrace that openness. And it's not trying to replace anything. This is just a plant. It's a supplement. We talk about it more so as just food supply. We're just missing some things in our diet. So it's just simply something that's really powerful that you can put into your diet and replace or give those nutrients, but to blend that into your practice and embrace that and move forward.
Right.
That's what we all should be doing, and I really just commend that for you.
Yeah, just the idea of getting. I've had so many pets, and I'm such an animal lover. Many dogs through the years, and horses, and just knowing when the end of their life is coming, if you can just get one more happy day, one more week, it means everything.
Yeah. And the spectrum of this is that every vertebrae has a endocannabinoid system. So we even know of someone that had a bird that was administering
someone
the product.
got the product from us for their bird.
So from there to horses, like we talk about our horse, at 1,100 pounds takes one dropper full a day of the product, which is basically a standard human dose. And so what's the results? So we have an animal that's coming off medications, that's coming off injections, things that could actually damage joints over time. He's a sport animal, and so you have to take care of things and do things in a way, but and you pay the price a little bit because there's some degradation in joints. I mean, you're using that. So over time, to take care of that, some of the standard solutions are going to actually degrade. But we're talking about something natural here, and so the ramifications are, you have an animal that feels better, and you have oftentimes coming off medications. There's expense, and then there's just longevity and quality of life.
It's amazing. So let's move on. I think Drew has a picture of Puff.
I can get Puff.
What's Puff's story, Dr. Jarboe?
Well, I just wanted to show this picture of Puff. Puff has a personal story. This is my.
Go ahead.
My stepson's cat. They had just brought my grandson home from the hospital, and Puff, you all hear me always when I talk about cats. I love cats, but I truly believe they're aliens. They got it wrong and came into that body. So Puff's penance for them having a child, or her punishment to my poor stepdaughter and son-in-law was to howl for about 4 to 5 hours during the night, and Mama and Father were not getting any sleep. And so this was going on for about 4 weeks, brand new baby. So I said, let's just give Puff some UltraCell at night and see. And so this is, a lot of people say that their cats and dogs don't like it. And I just took this video because Puff would run for the spoon. She loved it. And so I think that it's just like us. We all have different tastes and sensations. And so this helped them get through the first 4 or 5 months of having a newborn baby at the house, because we finally got Puff to settle down at night.
That's so cool. What flavor is that?
That's actually lemon.
Is it?
That's great. I was going to actually talk to you a little bit about giving this to we have 3 cats, and I can't get them to take it. I have to force it on them a little bit. But all right. So then we also have, I think, Tilly. What's Tilly's story?
Y'all picked my own animals here. Tilly's my German Shepherd. I just showing. I think that's lemon. Her just taking it. I mean, I give that to her periodically. She's 5 years old, and was just. I think I had a big surgery the next day and just needed some sleep that night. So went ahead and gave her. You see my pointer in the background running away because he actually didn't like the taste. That was berry, I believe, and he didn't like berry at all. Okay,
that's cute.
But with the cats, Christy, the trick with cats is you can put a drop on the inside of their wrist or on their filtrum, the split between the upper lips beneath the nose, and they'll just groom it off. You don't have to fight with them to put it in their mouth.
Oh,
okay.
So ask a doctor.
Yeah.
I should have asked you that 6 months ago.
Exactly.
All right, that's great. Okay, so then we have Lois. Let's take a look at Lois and tell us a little bit about that one.
Actually, Lois is the owner's name. And is here.
Okay.
This was Lois pre-cell UltraCell. While we're talking.
Okay. All right.
It looks like she's struggling a little bit, like maybe some nervous things or something.
Yeah. This is Marzipan.
Oh, Marzipan.
Oh, this is Marzipan.
Okay.
Marzipan had a limb amputation due to fibrosarcoma. She's I think she's about 5 or 6 in this video. She actually came to one of my associates because after the limb amputation, she was in horrible distress. She was normally what I call a dog cat. She was very much engaged with the owners, played ball, played fetch, always purred, always sought their attention, was an integral member of the family. After the limb amputation, and I think by the hair growth, we're probably about 6 to 8 weeks out. This is what she does. She takes a few steps, she growls. I don't know if you've got the video.
We do.
Yes, we do. Yeah.
He's pretty unhappy the whole time, just growling, not wanting to eat a lot. And they had tried, before coming to see us, she had been on Prozac, which takes about 4 weeks to have an effect. She had been on amitriptyline, another tricyclic antidepressant. They had tried gabapentin and steroids. And my associate asked me, do you think UltraCell would help? And I just looked at him again. Everyone kind of just tired of me saying, why wouldn't you try it?
Just try it.
Why wouldn't you try it? It's, the benefits outweigh any, concerns. So we've got another video. The second video is post treatment. And I think this is really 2 or 3 doses afterwards.
Okay.
Let's
see if we can see that.
Well, I've got Lewis.
We've got it.
Rafa.
Right, there we go.
Oh, I'm sorry. This is Rafa. Rafa is owned by Lois. Rafa's a 21-year-old cat, and you can see he's got a lot of osteoarthritis. His movement is very limited. So she wanted, she sent me this video of him moving like Tim Conway, and we can move to the other video, I guess.
Okay.
This is after UltraCell.
Wow, there's so many stories here. We could have used the whole hour. How do people? So we've got your email address up there, Jolie. So you're in Leesburg, Virginia.
How do people reach you?
Yeah, they can find you online.
Email is probably best.
Okay.
Email is probably best. I usually give me a day or two because that allows me to see your questions and concerns and how best to direct you. The biggest thing I want to stress to people is if you have an animal that is truly sick, we're having multiple seizures, we're dragging a leg, we're having blood in our stools or vomiting or lethargy, please see your veterinarian. They need to be evaluated. UltraCell may be a complement or a component of therapies, of things to give to help our cells be the best be. But that I just have to stress that.
Thank you.
Works best.
Thank you
that's
so
great.
much.
We can't thank you enough for being with us today.
We knew we didn't have enough time. We could do a follow-up on here so people can reach you. There's Fit Family CBD, our website. You can find product information there as well.
Information, and you can reach us. And if you want to reach out to Dr. Jarboe, you can do that by contacting us through our website, and we'll get you in touch with her.
Thank you so much for being on today.
Thank you.
Yeah,
All right.
Opening yourself up to the public and answering questions.
Great. Thank you, everyone, for watching That CBD Show. We'll see you next time.